Do you know how endovascular procedures are performed? Firstly, what is an endovascular procedure? These procedures are performed to gain access to more centrally located structures, such as the heart, a central tumor, or even the brain. In the past, these structures would be accessed directly. However, this is extremely high risk for the patient. So now, peripheral arteries and veins are used to access these centrally located structures. Commonly used access sites include the radial artery, the brachial artery, and the femoral artery. These sites are chosen due to their peripheral location and how superficial they are to the skin. This ensures minimal bleeding and easy access. The femoral artery will be selected if a larger device such as a stent needs to be inserted. However, the radial artery is the most common access site. To perform this procedure, the hand is supinated and the wrist is extended. A needle punctures the skin and enters the radial artery. Then a guide wire is inserted via a needle, which is used to navigate the arterial pathway. After passing through the radial artery in the forearm, the guide wire enters the brachial artery of the arm. The start of the brachial artery is defined by the lower border of the teres major muscle. Continuing proximally, the guide wire enters the axillary artery. Once again, this transition is defined by the lower border of the teres major muscle. Once the guide wire passes the lower border of the first rib, it is now considered to be inside the subclavian artery. If the procedure is taking place on the right side of the body, the guide wire will then enter the brachiocephalic trunk before entering the arch of the aorta. However, if the procedure is taking place on the left side of the body, the guide wire will enter directly from the subclavian artery into the arch of the aorta, as there is no brachiocephalic trunk on the left side of the body. We have now gained access to the heart. Any therapeutic or diagnostic procedures can be performed without the major risk to the patient.